Level 989.
Welcome to 989 on Health, where you don't need to use a university to understand the latest news about health and related subjects.
This is an informal discussion sharing our personal viewpoints on health and wellness. Don't rely on the information in this podcast as an alternative to medical advice from a professional healthcare provider. For the full disclaimer, please see our website.
As always, we've created a list of helpful links on today's topic at our website, level989.com, and those same links should also be available in your podcast playing app of choice. I'm Mike Davalos, just a guy, your average Joe, and I'm joined by the opposite of average, Brandon Weintraub, a primary care physician. Good morning, Brandon.
Good morning, Mike.
Our topic for today is something called scope of practice. This description seems kind of vague. That's probably because it's a term medical professionals use within the healthcare industry, not some catchy marketing phrase. Usually at this point, I would make some quirky joke or reference, but I'm still not sure what we're talking about. Brandon, what's scope of practice?
Scope of practice actually describes what health professionals can do in their professional practice and is defined by the state boards of medicine, boards of nursing, etc., often with the guidance or instruction, via statute, of the state's legislature. It's the collections of things a practitioner can do according to the law.
Okay, I get it now. Who does what? Who's allowed to do what? I'm not sure why, but your description makes me remember the old-timey barbers. Back in the day, you could go in for a shave and a haircut, also get a tooth pulled while you were at it, maybe even a little light surgery. In fact, the classic barber's pole, striped red, white, and blue, the red represented blood, medical procedures. The history of the barber's pole is actually pretty interesting and complex. You folks might want to read more about it. As always, the links will be in the show notes. I could go on and on about barbers. How did we get on this subject? Might have to trim this out during editing, but I have a feeling if I go on much longer, you're going to cut me off.
Wow, you had to wait an entire 2 minutes before your first joke. Was that difficult for you?
It was. It really was. Anyway, I had a point with the barber reference. While there was a time when barbers could perform everything from cataract surgery to removing a bladder stone, and that's history, that's not a joke. At a certain point, regulations were created that clearly defined what a barber could and couldn't do. It's actually one of the earliest examples of scope of practice in medicine. But why are we talking about this now? I mean, did they pass some crazy new laws about practicing and scoping?
Scope of practice is becoming a hot topic in legislation, litigation, and regulation. Western doctors are considered central figures to health management, and they're actively pushing to continue to be the ringleaders of the medical circus. Each time a new technique is introduced, medical doctors are eager to make sure it won't be outside their control or interfere with their financial interests. But it's important to remember that any variety of practitioner is best served by making sure treatment techniques fall under their sole control. It means that only that type of licensed practitioner is able to legally perform that particular service. Recently, it seems like the news is filled with stories of one type of practitioner trying to expand their scope of practice to cover something else. Often something they probably shouldn't be doing, really.
Yeah, I did some Googling and I came up with some pretty surprising stuff. Dentists who are delivering Botox injections, gynecologists doing plastic surgery of the face to plump lips and minimize wrinkles, and even pharmacists who can prescribe and fill your prescription. Who even needs a doctor anymore? Scope of practice just seems to be growing. I can see from a business standpoint that being able to offer your patients a bigger menu, more options, is probably going to earn them more money. And who doesn't like one-stop shopping? But are more options better or worse for me, the patient?
As always, patients run the risk of both benefit and harm, often at the same time. For example, last year in Florida, ARNPs, Advanced Registered Nurse Practitioners, and physician assistants were granted the ability to temporarily prescribe higher classes of drugs. As long as the prescription isn't filled for more than 7 days, Class 2 drugs can be prescribed and adjusted, a class of drugs which includes a number of types of pain medications. This can be especially helpful in terms of urgent and long-term care. In cases where a change in medication is needed quickly, a fully licensed MD would no longer be needed. The change is definitely a double-edged sword, though, as fully licensed doctors continue to overload their schedules and be driven to deal with more and more patients. Nurse practitioners and assistant physicians are now being used as a stopgap to take more of the professional responsibilities that are meant to be handled by physicians. Used responsibly, the greater scope of practice means patients would be able to receive more immediate and more appropriate care in the right situations. Used under less responsible auspices, it means medical facilities can use cheaper, possibly less expensive practitioners with inadequate professional oversight.
The medical provider that seems to have the most random assortment of possible services is also one that seems to get a lot of ridicule, and that's chiropractors. Based on the area where you live, a chiropractor can do anything and everything from a pelvic exam to casting fractured bones to writing prescriptions to interrectal manipulation of the coccyx. And that's fixing your tailbone through your back door, y'all. So the list of possible chiropractic procedures is long. Dozens of weird and random treatments, including some using acupuncture needles. Okay, Brandon, brace yourself for a rapid-fire series of questions. First, why do chiropractors seem to have such a bad name? Next, is that bad reputation deserved? Also, how do you feel about some back doctor using your beloved needles? And last, how could anyone possibly be expected to master so many different disciplines?
Some of those questions are really difficult for me to answer, especially since I practice a form of complementary medicine as well that's garnered its own collections of skeptics. Chiropractors have filled an interesting niche in the world of healthcare. According to the Institute of Medicine of the National Academies, 100 million Americans experience chronic pain, which means 100 million Americans are looking for some way to stop hurting on a daily basis. Osteopathic doctors and chiropractors started from the same general concept, that manipulation of the body could directly offset deeper-rooted health conditions. Osteopathic doctors took one path, increasing the amount of training and schooling they require to become a licensed professional, adapting their schooling to match more MD licensure processes. Chiropractic practitioners remained a little more on the alternative edge. They can't prescribe pharmaceuticals, which is practically a requirement in today's world to be considered a quote-unquote real doctor, and use muscle testing, herbal supplements, and bone adjustments to treat their patients.
Okay, so chiropractors can't prescribe pharmaceuticals, but neither can massage therapists, and they don't seem to have the same stigma. What's up with that?
Well, there are some concerns over some of the methods some chiropractors have adopted to make their practices profitable. While the adjustments they perform can provide relief for their patients, very few chiropractors manipulate the muscles involved in a condition they're treating, or address the ongoing causes that may be involved, say, when a person is exercising incorrectly and the muscles involved are what's causing a vertebra to go out of alignment. That means while the patient may get relief briefly, the only way to keep things from getting worse again is to keep going back to the chiropractor. There are also some concerns that, because of a lack of treatment options, chiropractors will make risky or inappropriate adjustments and possibly cause more damage than relief. And finally, the methods many chiropractors use to sell their supplements raises concerns in the medical community. Things like vitamins and minerals, when being treated in isolation, in other words, saying a vitamin B deficiency is the cause of muscle fatigue, are often diagnosed with a repeatable test of some variety. Often, blood work is involved. In many instances, chiropractors use a technique called muscle testing to determine if a supplement is appropriate for a patient. I'll spare you all the in-depth description for now, but I will say that I personally have an aversion to muscle testing as a viable means of prescribing vitamin or herbal supplements, and research studies tend to waffle on the usefulness of chiropractic efficacy, which I know is no surprise to you after all of the discussions we've had so far.
Okay, I can see now why you said it would be difficult for you to answer some of my questions. Sounds like the negative press chiropractors have received is based off a mixture of opinions mixed with research studies, which may or may not be accurate. Thinking about it, MDs have the same negative press depending on who you talk to. Things like a tendency to overprescribe medications, not paying enough attention to their patients. But what about my other questions? What are your personal feelings about chiropractors? Should they be using acupuncture needles?
I have referred a few of my patients to chiropractors, but I always give the same advice before making any sort of referral. Chiropractors are best when used in conjunction with other therapies if you want to have long-term, lasting results. I personally prefer physiotherapy to chiropractic. In the hands of a good physiotherapist, both muscular tension and structural issues can be addressed. But I have definitely seen patients get results with chiropractic adjustments when they were in severe pain. As for their use of acupuncture, there's no doubt that any medical practitioner could learn to use acupuncture in their practice. However, Acupuncture physicians like myself receive an average of 4 years of training on the correct and safe methods for acupuncture and Chinese medicine. Other practitioners, including medical doctors, are often asked to take a few weekend classes. Their application of acupuncture needles, in a process called dry needling, lacks the understanding and technique of a fully specialized acupuncturist. Essentially, unless they've gone through the extensive training I believe to be critical for acupuncture physicians, I prefer most medical practitioners avoid the use of acupuncture needles and techniques. Like any other specialty, I think referral to a proficient acupuncture physician would be much more in the patient's best interest.
I imagine it would be difficult to be a practicing medical professional and have some new law suddenly change your permitted scope of practice. Even more scary, it can happen at any time. If your brain of medicine gets some negative media coverage from somewhere 1,000 miles away, new restrictions and policies can be the result. Depending on your specialty and how diverse your patient base, you can see your biggest opportunities for income just evaporate overnight. You might have to call a bunch of your patients and just cancel their appointments because you can no longer perform some procedures you've been providing for years. Your patients know and trust you, but now they have to go find some new provider, even though they may not want to. Now, do I remember correctly? I seem to recall that while you were in school for your current medical degree, some scope of practice changes occurred that meant you could no longer treat patients in nursing homes, or was it veterans hospitals, with acupuncture? So your expected customer base dwindled before you could even graduate. That had to be something of a wake-up call for you and your classmates.
It wasn't really a scope of practice change exactly. While I was in school, and some of this is hearsay, so please don't sue for libel if this isn't exactly correct, the director of the Veterans Hospital program in my local area decided he didn't think acupuncture was useful. And this was right around the time the US military started looking into ear acupuncture for treatment in the field. The jobs that were available for acupuncture specialists disappeared. The new director has adjusted the policies since then, and acupuncture is again being integrated. But it does offer an example of how fickle a field of practice can be.
One article I found during my research was a piece on massagemag.com about the importance of staying within the bounds of your scope of practice. I like to offer the byline of a specific writer, but it's not listed. Anyway, I like the phrasing they used. I'm just going to quote from a part of the article here. Working within scope of practice isn't just about what you do. It can also be about what you say to clients. If you're not a licensed nutritional consultant or dietitian, and you talk to clients about food or supplements, you're working outside your scope of practice. If you're not a licensed athletic trainer or exercise physiologist, and you talk to clients about exercise or physical activity, you're working outside your scope of practice. If you're not a licensed mental health care provider and you offer clients advice on their mental health, you're working outside your scope of practice. If you ever need to remind yourself of your scope of practice, your first resource should be your state regulatory board. I've seen too many therapists exaggerate their level of training or credentials. By doing so, they're misrepresenting themselves and providing a disservice to their clients. Properly referring clients to a licensed medical professional will also create a great degree of respect from those professionals. I have had scores of new clients referred to me from physicians because I knew when and where to send clients for proper diagnosis and treatment. End quote. I've worked with a lot of professionals in the service industry, and I think many clients, patients, regular folks underestimate how important repeat business is to a service provider. Whether or not the 5 patients you see today rebook their next appointment is life or death for the business of some providers. Not to get all science fiction-y, but it's almost like a split in the timeline, because an opportunity to rebook can either lead to a profitable future or a failed practice. Getting that initial base core of regulars can make all the difference, especially when it's a newly started practice. I think the article I just quoted from makes a number of good points, but Brandon, can you explain and or speculate, if you have to, what would make a medical provider overreach their designated scope? Does it just slowly creep and spread over time? Is it arrogance, ego, a need to be helpful, desperation to keep a client as a regular? Maybe just fulfill as many needs as possible for a patient so they just keep coming back?
That is an incredibly complex question. Honestly, I think practitioners start overreaching their scope of practice for so many potential reasons. On occasion, there are legitimate reasons to think scope of practice ought to be expanded, and it can require a lot of effort to make that happen in the courts. Other times, practitioners believe they've been better trained or have more experience than they really do. There's also money in them there hills. As a practitioner, being able to do more for your patient can make all the difference to a fledgling practice as much as an established one. And finding things that work for your patient is critical. So if one method works for a particular practitioner, even if the method is slightly outside their scope of practice, the temptation to do more can be a tough one to ignore.
For the most part, and probably from a legal standpoint, it's up to the healthcare professional to know what their boundaries are and to remain within them. But what responsibility does the patient have to be informed about the scope of practice of the various providers they get treated by? And how would I even know what my dermatologist is and isn't allowed to do in my state? And don't tell me to go read a big stack of legal documents, because people are not going to do that.
Truthfully, there isn't an easy way to know what a practitioner is or isn't allowed to do. Unless you do feel the yearning to read a ton of official documentation, and even then, you may be in for a fun little adventure. Practice Acts can be incredibly non-specific in the wording. I'm going to spare you all the lengthy, quotation-filled examples for this podcast, but feel free to take a look at the links portion of our website, level989.com. I'm putting in a link to the California Acupuncturist Scope of Practice. It's a 57-page document explaining and comparing, and it'll give you a wonderful taste of what scope of practice is all about. It's actually kind of scary. For the most part, it almost seems like a practitioner could get away with doing almost anything, unless something goes incredibly wrong or enough patients decide to ask the right questions enough times and loudly enough. Who's ever going to know what one small physician is doing?
Now, when it comes to one of the earlier examples, like some gynecologists offering Botox treatments to get rid of worry lines on your forehead, I mean, a Botox injection is fairly minor in the scheme of things, right? All right, hold on. Since I keep referring to it, maybe you could break down what a Botox injection is and what side effects a person might expect.
I'll give the basics as I understand them, but I definitely don't have the certification or training needed to give Botox injections myself. Botulinum toxin, or Botox, works by stopping signals being sent to the muscles from ever reaching their destination, effectively paralyzing the muscles in question. In order for the muscles to contract, nerves release a chemical messenger called acetylcholine. This chemical attaches to receptors on the muscle cells and causes the muscle to contract. When botulinum toxin is injected, acetylcholine isn't able to be released, which prevents the muscle cells from contracting. That's why Botox is used as a treatment for things like wrinkles or frown lines. When used correctly, in the right concentration, the right dose, and in the right locations, letting the muscles relax can make a huge difference. As for possible side effects, unfortunately, the list is fairly long. To keep the podcast a reasonable length, I'll list a few now, and you can find a link to the rest of them on our website. Some of the most common side effects are mild pain, local edema, that's swelling, and redness, numbness, headache, and localized muscle weakness around the site or sites of injection.
Okay, so I'm sure my gynecologist or other providers taken the necessary classes to certify in the Botox procedures, so they're probably allowed to do it, if they're offering it. Now, if I'm a woman who's been going to the same gynecologist for years, maybe they've seen me through a pregnancy or two, and I trust them because they've consistently given me good care, more than some plastic surgeon I've just met. Why not allow the gynecologist to do the Botox treatment for me? Is there any data that demonstrates that the specialist is better for something like this?
That's actually part of the problem. I did a little searching around online, and honestly, I wasn't able to find a whole lot of relevant statistical information regarding the potential risk or benefit to using a specialist or particular type of practitioner for Botox injections. There are, however, a ton of opinion pieces about the topic. The initial argument was really about whether an MD, specifically a plastic surgeon, is the only professional who is capable of correctly doing these sorts of injections. That argument seems to have been discarded, but there's nothing specific about which variety of training or type of physician is actually going to do the best job and reduce the risk of mistakes the most.
This might be a silly or naive question, but if a medical provider offers me a service that doesn't logically seem to be in their scope of practice, like my dentist offers to perform a kidney transplant for me, would it be smart of the patient to directly say, "Are you qualified or certified to do that?" I mean, they can't just straight up lie, can they? It's like if a cop is trying to entrap you and arrest you for something, and you ask them, "Are you a cop?" They have to tell you, right? Or is that just something from TV?
Entrapment is indeed a thing, and I wish I could tell you that you could be 100% sure that the answer a doctor is giving you is the truth. Unfortunately, what's legally required and what people will do ethically are two very different things. Ideally, you're correct. If asked directly, your practitioner should know what he or she is legally allowed to do. The bigger issue falls into those methods of treatment that are in a legal gray area. I'll use Botox injections as an example. Yes, legally, a gynecologist has gone through the medically required training and has the ability, according to the law, to give Botox injections. As long as they go through any additional training, according to the letter of the law, they would be able to answer your question, are you within your scope of practice to perform this procedure, with a firm and resounding yes. However, if your gynecologist hasn't ever performed the procedure, and took the certification 2 years ago, and hasn't been keeping up with the latest information on how to perform the procedure, there's an ethical reason for them to tell you that they should not perform a Botox injection for you. Worse, if the physician or practitioner simply feels they are capable of performing the procedure, there's always the risk that, being profit-driven, they will stretch themselves outside their legal boundaries, especially if those boundaries are a little unclear in their terms and usage.
When it comes to what any practitioners are permitted to do in their scope of practice, would it be possible to use insurance as a red flag or barometer? What I mean is, if you've been seeing a practitioner for a while and everything so far has been covered by insurance, and all of a sudden some new procedure they're offering has to be paid for in full by the patient, should that be a hint that something a bit shady is going on, that they're trying to do more than they should? Or is insurance a hit and miss thing to begin with, even when you stay within your scope of practice?
Insurance may be the best way for a patient to know what's going on, and maybe not. It is true that in many instances, insurance will only cover the procedures that a particular specialist is best able to complete. But there are other considerations. I'll give you an example from my own practice. Acupuncture, as it stands now in Florida, is more or less only covered by a small number of insurance plans. And those plans often cover only specific treatment types, and often only for pain conditions. Even though acupuncture can treat a wide variety of conditions, if it isn't pain-related, the claim often gets rejected. Worse, herbal medicine isn't covered at all, which means many of the best techniques we have to help patients feel better remain outside the reach of those who need it the most. And acupuncture physicians in Florida are required to be trained and certified in Chinese herbal medicine to obtain their license. In short, I guess insurance isn't the best way to figure out scope of practice either.
It's a tricky problem. Is there anything else you want to mention about scope of practice before we wrap it up?
Well, as you've undoubtedly put together over the course of today's episode, scope of practice is no easy thing to decipher. Even if you are willing to do the reading and the research required, oftentimes it will turn out that there's no hard and fast and clear rules about what one practitioner can do over the other. The motivations for delineations are often just as unclear. Is it monetary concerns that led one group to ensure they are legally in charge of a procedure? Or is it genuinely best for the patient? This lack of clarity is why I'm constantly advising you all, our listeners, to make sure you have a team of physicians you feel comfortable with and confident in. In the long run, it's up to each practitioner to understand what they are feasibly able to do for their patient, how much they understand about the medicine and techniques they are applying on a patient, and what repercussions might come from those actions. Having a doctor you trust to do only the things that are in your best interest and not purely for monetary gain is by far the best thing you can do to ensure you are getting the quality of care you deserve.
That's all the time we have for today. These short episodes are a brief overview of very complex topics. Everything we say is for entertainment and educational purposes only. Licensed healthcare professionals should advise you and be aware of changes you're planning to make to any aspect of your healthcare. Every person's needs are different. The links to references we've made about news articles, medical studies, or other materials can be found at level989.com, along with our contact information and the complete Don't Take Medical Advice from Podcasts disclaimer. Don't forget to take a moment to rate or review us in iTunes or give us a mention on social media. We can't inform the folks if they don't know we exist. Thanks for listening, and now go health yourself. Now that we've completed the main topic for the day, I thought we might include a brief segment on personal health care. I gotta say, I have not been doing a good job of taking care of myself lately, and I'm hoping that by speaking out with my struggles and holding myself publicly accountable, I'm gonna find a way to improve. I know for me, it's partially the weather. It's been crazy hot here in Florida. My treadmill broke a few weeks ago. I think you've been having a rough time of it lately, too?
I have indeed. I seem to have created a heck of a complicated cocktail for myself. Growing Origin Clinics, my integrated acupuncture practice, while at the same time continuing my work as an IT consultant, has created an environment ripe with excuses not to hit the gym as often as I should, or to keep my diet healthy and on target. Honestly, I stopped going to the gym for almost 2 months, with only the occasional run to keep my heart healthy.
I hear you. I'm not exercising, I'm snacking constantly, I'm not sleeping enough. I know that weight is not the end-all, be-all of health, but it's definitely a factor. And just to establish a starting point that I hope to improve with each new episode, I weighed myself just before we started recording this morning, and I weigh almost exactly 200 pounds, or 91 kilograms. And apparently my ideal weight would be somewhere around 160 pounds, or 72 kilograms, so there's definitely some work to put in there. I hope to really focus on doing better and report in during each episode going forward. Now, if you had one recommendation that I should try to focus on, what would it be?
Based on some of the reports I've been reading lately, I would say that sleep might be the most important thing you could work on. A healthy sleep cycle seems like it may have the ability to help moderate weight, assist with building muscle, and even change the way our food is digested and nutrients are absorbed. The worst part is I think that sleep is the one thing I will have the most difficulty getting adjusted myself. There's just so much to do all the time, and I know that stress usually keeps me from being able to follow my own advice.
And what personal health goals are you shooting for?
Well, I'm still hanging out right around the 180-pound mark, which is at the upper end of my normal, according to the BMI, but a little higher than I'd like to be. So I've started my own little challenge to myself and added a 5K a day to my workout routine. 5 days a week, I'm making sure I jog at least 5K to try to get myself in better shape and back into the swing of proper exercise routines.
I didn't know. That's a lot. 5K a week I'd be impressed with.
Yeah, I would really like to get myself up to doing a full 10K a day and doing that probably 4 times a week and managing to get my run time down to a pretty solid 8-minute run. So
that's impressive.
Yeah, we'll see.
So can you just like right now go run 5K without stopping?
Yeah.
Wow.
It takes me about half an hour, give or take, maybe a little less. So, my run time's not great, but I was doing really well there for a while. I was managing to get almost, 9-minute solid, 8.5, 9-minute solid ongoing. So I was able to keep pushing past it, but I've lost some of that, unfortunately.
Well, you'll get it back.
That's what I'm hoping.
That sounds like a plan. I'll try to keep notes so I can have something of a report on my progress next time. Not just my, hopefully, lower weight.
I'll start doing the same. I should be able to start recording my stats like heart rate and steps, distances, and times of my jogs. Maybe we can throw some of that in. It'll help me stay motivated to keep my goals on track.
Sounds great.